Hey guys, welcome to another Teatime rant where I am moaning cogently about something that doesn't matter to anyone except me. Today's rant is more of a general moan, so I'm just here with a cup of regular own brand tea. I apologise if the noise here is a little excessive. I'm doing this down the workshop, not from home. And again, if the lighting is not great, that's because the lights here have just burned out, so we've got to replace those. That's high-pitched and annoying. Today my quote-unquote rant is going to be about our health service. You see, over the world, many people with poor health service, let's take a random example, America, unless where you're rich, you die, especially the way things are going now, and people use ours as an example about how great it could be. Well, I'm going to be honest, yeah, we get free healthcare, but it sucks compared to how it could be. You see, the problem is, our NHS, the National Health Service, that's our free healthcare to anyone who doesn't know, is badly mismanaged and underfunded. There, I said it. The problem is that our NHS is supposed to be there to help everyone, and it needs a lot of money to do that. Unfortunately, our government has, at least our current government, has decided that the money that could go on there would best go on keeping themselves in power and making sure that the rich get their tax breaks. And it's not a problem exclusive to this government. It's happened in previous governments where the NHS has been underfunded. It's been having problems, waiting times have been too long, so they've been told to fix it. Treatments have been ineffective because they're unable to deliver them properly. And do you know what a previous government solution to this was? Hire more managers. The problem is that the money it had was already being mismanaged. It was going into the managers' bonuses and crap like that. And so when it came around to hiring staff, well, I'm sorry, no money. You know, just bring down waiting times by employing more doctors and nurses. No! Let's hire more managers to make sure the money goes into the right place. Oh no, these managers need a salary. Oh look, the money's all gone. And so you end up with too few nurses, too few doctors, and the ones that are there, some of them just don't seem to care. I can give personal experiences of this. I was in hospital, admittedly this was just over 10 years ago now, with a broken leg. And I was in a room, I'd somehow managed to be put into a private room, maybe the guy who'd been in there before me had died through neglect or something. But the nurses that were seeing to this ward did not care. There was a lady in the room behind mine who was an elderly lady, and they were actively ignoring her. The nurse's room was actually just outside my door. It was basically outside my door, down the corridor by about 10 feet, and it's on the right. And the alarm would go off from the room behind me to call a nurse. You know, she'd push the button to call a nurse, and no one would go. And so she'd start shouting, calling for a nurse. Nurse! Nurse! And they'd continue ignoring her. One of them even said, this was after I had pushed the button once. I had pushed the button because I was in pain, because I had a gaping hole in my leg and the bone was shattered. And the nurses, in the nurse's office, said, just ignore her, she'll calm down soon. Yeah? That was me having pushed the button to request a nurse because I needed some pain medication, and they'd ignored it because they thought it was the woman in the room behind me. Best part about this, yeah, the very best f***ing part, she was calling them because she needed help, and they ignored her. She'd pushed the call button, no one went to see her. She called out, no one went to see her. She started rattling things. She was banging bowls and things on the table. At least I presume it was a bowl. She was banging something on the table and shouting for a nurse because she needed someone to come and see her, and they ignored her. Yeah? A little while later, someone went in there, and I heard them say to her, "Oh," I'm not going to say her name because I don't want to embarrass anyone, but said, "Oh dear, you need to let us know when you need the toilet." I couldn't hold my tongue at this point. I shouted out, "She's been trying to for half an hour." And I got ignored saying that. No one came to see me about it. No, when I pushed the button and they said, "Ignore her, she'll calm down soon," I had to yell that it was me who needed help because I was in pain. But that was 10 years ago. Now, today, things are worse. Waiting times are officially shorter because you'll sit in one waiting room and then they'll take you through to another one. And then they basically start the clock again in that waiting room. At least that's how they were doing it the last time I knew that they were doing it. It may have changed since then. They may have been reprimanded for that. But at one time recently, the method of getting waiting times down was to take you from one waiting room to another waiting room and restart the clock. And of course, because the NHS is underfunded, they have to shop out. I mean, eye exams now, in the preliminary, are done by opticians. Splashing me tea everywhere, I guess I'm getting more angry than I thought I was. So if you've got a problem... I mean, I recently had a problem where I was getting haze in my eyes around light sources. So I went to the doctor with this, thinking I'd, go to the hospital and get something seen to. No, they referred me to an optician. Fair enough. I figure optician, probably not a bad place to start. So I went to the optician and they diagnosed me with Fuchs corneal dystrophy, where basically the rear layer of my cornea stopped removing excess fluid. Now, I asked her what can be done about this, because that's a pretty dire diagnosis. Fuchs corneal dystrophy, if you're lucky, a transplant can help you. A corneal transplant can help you. Other than that, it is a degenerative condition which just keeps going, will not go... Well, no, I say will not go away. There have been very rare cases of spontaneous remission, but those are so rare that you can basically consider them a miracle. So I asked what can be done about it. She said, "Oh, nothing. Can't do anything about it." Well, that's f***ing great, isn't it? I've just been diagnosed with this condition that's going to last me the rest of my life and only get worse, and I'm given nowhere to go about it other than get used to it. I mean, I researched on it and found out, yes, okay, a corneal transplant can be done when it gets bad enough, but I thought this basically meant the end to everything I wanted to do. It meant an end to the artwork, meant an end to driving, because a lot of people with it end up with a haze that actually stops them driving. And bear in mind, I'd not long been back on my motorbike before this, so I thought, this is great, I've just started this, and now I'm going to lose it. I've just gained my independence again, now I'm going to lose it. Anyway, as I was researching, I was going to the doctors and saying, look, can anything be done about this? What can we do? Where can I go next? And I was actually waiting on an appointment to see someone at the hospital, and bear in mind, the waiting list at this point was about 3 months. Just to see someone to get it looked at. And while I was waiting, my left eye spontaneously overnight went completely hazy. I had no focus in it. I could not adjust the focus in my left eye. And it was insanely painful. So I actually ended up having to go to accident and emergency to get it looked at. And that is one of the crux of my argument here, is that it has to be an emergency before anything can be done most of the time. Because before it was an emergency, I was waiting on an appointment to see an ophthalmologist for 3 months. I was on a 3-month waiting list before it got this bad. I had to go to accident emergency. They looked at it and said, yeah, that's not Fuchs dystrophy, that's something else. You need to go to a specialist eye doctor. So they sent me to a specialist ward where they looked at it and said, yeah, that's uveitis. I said, what's uveitis? Well, it's a swelling in the front portion of the eye, and you treat it with eye drops. F***ing eye drops. I had been waiting all this time, where if the optician who looked at it had diagnosed it properly, I could have been given a set of eye drops and it would have been gone in a week or two. No, I ended up having to have a aggressive course of steroid drops into my eye 6 times a day, and another belladonna-based, deadly nightshade-based one to dilate the pupil in my left eye, because what had happened there is the swelling had become so bad that it had gummed my iris to the lens. And so that's why I had no focus, that's why it was amazingly painful, was because of the swelling, because it had gummed itself down. Now you say, okay, maybe it's an easy misdiagnosis to make. Maybe it is. The presenting symptoms of haziness between uveitis and Fuchs dystrophy, quite possibly. Fuchs dystrophy is an inherited condition. The chances of it being down to a chromosomal mutation are, I believe, 1 in 50 million. And they could have basically eliminated that as a possibility by just asking the question, is there a family history of dystrophy? No? Oh, well, it's almost certainly not that then. So let's look at other alternatives. Could it be uveitis, which is exactly the same symptoms? Yes. Well, here's the eye drops. Go away. You'll be better in 2 weeks. But no, I had a misdiagnosis which led to a delay in treatment. Sorry, wanker on a bike. I've no problem with bikers. It's wankers who go around razzing the off-road things along the roads. Rant for another time. Yeah, this misdiagnosis led to a delay in treatment, so that when I did get treatment, it had to be super aggressive, and the treatment itself has left me with a cataract in my right eye. Luckily, only a very slight one, so I experienced just slight hazing around light sources. My left eye, there's been deposit left on the lens, so I've got haze in that. Now my right eye, at some point when it gets too bad, I can get a lens replacement operation and that'll be relatively gone. It'll be improved over what it'll be by the time they get round to giving me the replacement. The left eye, nothing can be done about that. You know, they can't just get a squeegee out and scrape the lens off. No, I'm stuck with this basically for the rest of my life. So thanks to the NHS having to shop out because of mismanagement and lack of funding, I've been left with a lifelong problem now. And I tell you, your eyesight, it is one of those things that you really take for granted until you think you're going to lose it, which I did. I actually thought I was going to go blind because of the dystrophy, because, again, corneal transplant operations, they will leave that until you can barely see. You know, they will leave that until you're basically legally blind before they do anything about it, at least on the NHS. And that's even if you make it to the top of the waiting list, which is going to be another rant for another day about organ donation. I'll cut that part short right now. I am registered as an organ donor. When I die, take out anything useful from me and just chuck the rest in a mincer for all I care. You know, what do I care? I'm dead at the time. As it is, when my right eye gets bad enough, and again, I'm going to have to be basically legally blind, they'll be able to do a lens replacement with an intraocular artificial lens. But until then, I'm stuck with this unless I can go private. I'm drinking my tea slowly to try and make it last to the end of this rant. I may have to go and make another cup. Well, this is going to be the first 2-cup rant by the looks of it, maybe. In fact, I'm just off to make another cup up. Bear with me a minute. Right, back with cup number 2. That may have to be a measure of how bad things are, anything, and how many cups of tea it takes me to get through the rant. It's not the fault of the NHS. Very well, there are some faults in the NHS, but that's the same with everything. One of the faults lie with the government, who thinks that in order to handle money better, you need to employ more managers. Of course, as you can imagine, what happened to me left me depressed. I mean, I was misdiagnosed. I didn't realise it at the time until later, but I was misdiagnosed with something that was going to last me forever. That depressed me. I was told it was incurable, which depressed me. And even when I found out that there was a treatment for it, it was basically not necessarily that effective, and I was going to need to be practically blind before they would do anything about it. So you can imagine, that sent me down into a bit of a f***ing spiral, and that's lasted since then. I've been depressed from this for several years now, and I'm admittedly only recently starting to seek help for it again. I know I should have before, but the problem with depression is that a lot of the time you just don't care about getting better. You know, you feel like shit. You know you should care about getting better, but you just can't. At least in my case. So anyway, I've recently sought professional help again, because I did receive it in the past. And in the first instance, when I first did it, you had to go to the doctor to say you were worried about your mental health. The doctor, if they were convinced that you needed that help, would put you in touch with what's called a gateway worker, who you'd have another appointment with them 2 weeks, 3 weeks, 3 months later. I mean, I was actually relatively lucky. I got in within a month to see the gateway worker. They discuss your condition with you, and if they are convinced that you need help and that there's something they can do to help you, they will refer you on to whatever mental health help you need. I had cognitive behaviour therapy. It did work for a while, then something else happened which spiralled me down into a deeper depression again, and I lost almost all of what I'd gained from it. But now I've been back to the doctor because I want to get better, and it's a little bit different now. You basically skip... after you've seen the gateway worker, there is a telephone call where they assess you again to see what help might be available, what help might suit you. And so I went to the doctor recently and said, I'm worried about my mental health. Can I please be referred back to some sort of help? And now it's a case of, okay, if you've done it before, you can get in touch with the Wellness Hub, or I actually believe you can self-refer without seeing the gateway worker now. I'm not entirely sure on that one. But anyway, it basically just jumps the gateway worker straight to the phone call where they assess you, and if they decide that there's something that would help, they will refer you on to that help. And the waiting list for cognitive behaviour therapy, at least, in my case, is now 3 months. So, I mean, okay, yeah, I've experienced this depression for years. Another 3 months isn't going to necessarily kill me. But the fact is that it shouldn't have to be 3 months. There are people feeling suicidal who are actually a risk to themselves, who have to wait this time, and just the waiting could be enough to push them over the edge. So, congratulations, Theresa May's government, you're killing people. Okay, yeah. They've recently made a pledge to improve mental health services by taking on more psychiatrists, more therapists, more nurses, and that's all well and good, but in an economy where they've decided to cap nurses' pay rates so that wages don't go up in line with inflation, the only nurses you're going to be able to get are the ones desperate for work who may well not care. And I genuinely feel sorry for the ones that do, because they're trapped in this system that just doesn't appreciate them. You know, I mean, many of them, all they may know is nursing. Some of them may have a backup profession to fall back on, but many of them, either all they know is nursing or all they want to do is nursing and help people. But they can't do that because they're in a system which fundamentally undervalues them. While MPs vote every year on however huge a pay rise they're going to get. Sorry, this is actually upsetting me quite a bit. This is turning into far more of a rant than I thought it would. I wish I'd had some stronger tea now. I mean, recently, Jeremy Hunt was asked about this very question on a news story about bringing in more mental health workers, and he was asked, you know, how are you going to bring in these people, these nurses, when you've capped their wage rises? They're not going to be earning enough to live on. The question was something along the lines of, do you honestly expect nurses to want to come into this when you've capped their earnings at a point below inflation, and so they're not going to be earning enough to live on? His answer, was it a yes or no answer? No, he reiterated exactly what he said before about that they are going to be bringing in more mental health professionals. He didn't say how they were going to do it. He didn't explain whether he thought people were going to want to do it. No, he just said, no, we're going to do it. But that's great. How about a f***ing answer? So, nowadays, yeah, we've got free healthcare. And that's brilliant. Don't get me wrong. Without the NHS, I and many, many, many other people would be dead. You know, without the NHS, I'd have been lay on the side of that road and I'd have just had to die there because there is not a chance in hell that I can afford private treatment. Sorry, I didn't mention earlier that the broken leg was after a vehicle accident where a car slammed into my motorbike from the side. So yeah. Without the NHS, I would be long dead now. So don't get me wrong, I appreciate the NHS. I love the NHS, and I am very thankful for what it does. But compared to what it could be, it sucks. Because they're not allowing it to be all it could be. And the fault is not with the NHS. Well, okay, there is some fault with the NHS. Nothing can be perfect. I'll say that now. You know, you've got nurses going into it who simply don't care. It's just a profession to them. You know, their school or college or whatever said, oh, have you thought about nursing as a career? And they went, yeah, all right then, and gone into it and found out that, you know, they don't actually like caring for people. When I was in hospital, I was on antibiotics because of the gaping wound in my leg, and they were making me sick. And so I was stuck in my room throwing up once. I'd called the nurse in. 15 minutes later she arrived, and I said, I'm going to be sick. Can you bring me something to be sick in? Bearing in mind, I'd been feeling nauseous for about 15 minutes. And she came in with this kidney dish, and I immediately upchucked into this thing. And she left the room, and just outside, went to another nurse and said, can you deal with this? I can't stand sick. And if it hadn't been for the fact that I was throwing up profusely, I would have yelled, you're a f***ing nurse, this is part of the job. If you can't handle sick, you're in the wrong profession being a nurse. I'm sorry, there I said it. So I'm not going to say the NHS doesn't have its faults, but when the government's idea of fixing it is to throw money in places it doesn't belong and come up with plans about changing waiting times by saying, right, you've been waiting in this room for this long, so now we're going to move you, you're going to be seen to this room where we're going to start again. That is fundamentally wrong. That's diddling the numbers, that's not actually changing anything. And a government that says, I'm sorry, but we can't afford your pay rises this year, we've been too busy with ours. Oh, sorry, we can't afford to give you more money so you can afford to live. We're too busy paying ourselves for doing all. That is wrong. There is another problem for the NHS, and as a result, with the NHS. But I'm not leaving it there. No. Problems are with people as well. The public who treat it as an aspirin dispensary. There are people who will go to the doctor with a hangover. Oh, I've drunk too much last night. Oh, I feel like I'm dying. I'm going to go to the doctor and see what they can do. Maybe they can put me down humanely. No, off. If you haven't got any aspirin in, walk to the corner shop, buy a pack for 16 pence, and just drop a couple of them. You'll be fine in a couple of hours. Do you know how much that costs the NHS? I think that packet of aspirin cost the NHS about 10 quid. Maybe more now, I don't know. I should probably research these things, but with an unplanned rant, it's difficult to plan. It's difficult to research because you've got no idea what you're going to say. Anyway, it costs the NHS a ton more than 16 pence or 32 pence or however much you spend on your aspirin at your local shop. And don't waste your money on the brand name stuff. The 16 pence stuff is literally the same. This has become a big rant. I just reached the maximum file size. Anyway, as I was saying, if you can afford the brand name stuff, fine, go for it if you want it. But if you're saying, I can't afford the brand name stuff, it's £2.39, I'm gonna go to the doctor and get some for free, then you're a f***ing idiot, because the 16p stuff literally contains the same as the £2.39, £3.59, whatever brand name stuff. By law, it has to contain exactly the same. See, I am getting angry now, I'm splashing me tea everywhere again. So, because you're feeling lazy, because you don't want to pay 16 pence or £2.39 or whatever for aspirin or paracetamol or ibuprofen, you decide to go to the doctor and you decide to spend X amount of the NHS's money on a packet of aspirin. And that is just disgusting, because, okay, you think, well, it's 10 quid, the NHS gets however many billion. Yeah, it's 10 quid when you do it. When 100 people do it, that's £1,000. When 1,000 people do it, that's 10 grand. When 1 million people do it, it's busting the NHS. Of course, yeah, 1,000 times 10 quid, yeah, it's 10 grand. Sorry, I'm getting so angry I am failing to numbers. So, everybody looks at things like this and says, oh, the NHS is failing, we need to privatise. No, the NHS isn't failing. We are failing the NHS. We are failing the NHS because we're taking money out of it for unnecessary things. We're not managing the money that they've got properly. And what's more, a little bit of a political aside here, when a government says that we can't afford to raise your wages this year, and then goes and gets themselves a pay rise, that's bad enough. When a government says there's no money for the NHS, and then spends 1.5 billion to get into bed with another party, just so they can maintain the majority bastards, and I'm sorry, but the Tory government are a load of bastards, because they would quite happily see people like me dead if it meant they got more money. That is why our NHS is in trouble, because we're not treating it right. The problems that I've mentioned are still going on, because I have got a swelling in my throat. I've been to the doctor, who's had a look, and no idea what it is. So I was referred for a blood test to see if it was a thyroid condition. I had the blood test, I had to wait a week to get that done, which admittedly could have been worse. I had to wait a week again for the results, which again could have been worse, and it came back everything clear. They found no idea what the cause is in my blood. So that had to make an appointment with the doctor again. Had to wait another week to see the doctor, and even then that's only because I called up on the day that she was doing on the day appointments, and it's essentially emergency appointments, which again plays back to my thing of you don't get seen unless it's an emergency now. And with how worried I am about this, I potentially class it as an emergency, because it is getting worse. It's not going away, it's not easing off, it is steadily getting worse, and I can constantly feel it pressing in my throat now. But I went back to the doctor, and she said, okay, we'll send you in for an ultrasound on your throat so they can map it and try and see any swelling in it. And great, that's fine. So, okay, right, well, what you got to do is you got to wait for your appointment to come through, and you'll get that in about a week, and then go to your appointment. Again, I don't know what the waiting times on this is, but the week was not for when I would be seen, it was for when I would get my appointment. And I waited a week, nothing. I thought, well, okay, maybe it's something up. So I waited another week, still nothing. And again, this is all the time getting worse by the day, and I've been in touch with with the surgery and the hospital to try and find out when my appointment is, and no one can give me any answers. I've got the surgery saying we'll try and hurry it up, I've got the hospital saying we'll look into it, and I still don't know when I've got to go in. For all I know, I've missed my appointment, been marked down as a did not attend, so I'm not going to get another one. And all the while, I've got this thing growing inside me, and I don't know what it is. I don't know if it's a thyroid condition that the blood test missed. I don't know if it's cancer. I don't know if it's just that I'm getting fatter around the throat. Sorry, I'm upsetting myself again. Well, I'm almost out of tea, so I'm going to cut this there, but feel free to compare our health service to yours and say, well, look, they've got it better, they've got free healthcare, people are surviving because they can get treatment. And yes, that is the case, but don't extol it as some perfect system where everybody gets fine and nobody suffers, because that's not the case. It's not a perfect system. People are dying because their treatment's being delayed. People are suffering because their treatment's being delayed, or it's decided that it's uneconomical for the NHS, and the money is just not going into it to improve it. So America or anywhere else where you've not got free healthcare, feel free to build a healthcare model based on ours, where we all pay a little bit on our taxes, just a few extra quid, and we get free healthcare. But do a proper job of it. Run it like a health service and not like a business. Well, this is Teatime Rants, with what I thought was going to be a moan has turned into a 2-cup rant. Signing off until next time, and everybody, try and be healthy, because you're f***ed if you're not.